currently I'm having one patient work on the driving simulator.
How has his experience been with that?
It's been really good. He has improved his reaction time tremendously, actually. I think he went from like a minute and something to now 0.6 seconds. And he's really understanding now and remembering which buttons to push, and he's very familiar with it. And so he's gaining confidence with his ability to be able to react.
Do you have any other patients that you have used the solution with?
I do. I've also used another one because it gives you suggestions on what else you can work on for reaction timing. Rhythm therapy.
Okay.
So I have been doing that one with him in standing.
Nice.
To work on his proprioception and his balance, and then also his reaction timing. That has really been a challenge for him because when you're taking away, sight, as far as, not being able to really see. So that really challenges him and, hones in on his balance. He's done very well with that.
Have you seen the progression, like the first time he tried it?
Yes.
Okay.
And he wanted to hold on to something, and once he got more used to it and got a little better with it, he was able to stand there confidently and reach.
Okay.
So another one that I've worked with him was the play ball. And he was like really like diving for the ball. Yes, he really enjoys it. It's like kind of takes you to a whole different world. I've had other patients also that have just been, they don't realize they're doing therapy.
Right.
They're just having fun. And I'm able to, engage them in therapy in different ways to where they're like, oh, we're done already. It's been an hour, So, yeah, they really enjoy it. It's a different way to get them involved and engaged, and they move more and they don't realize it.
So it's exactly what happens with virtual reality. We've seen patients that thought that their range of motion or how much they can move is restricted, but it's actually really not. It's mostly a mental barrier.
Yes.
Right.
We also had another patient that was paraplegic. Just barely could move her arms or anything, and we put the controllers in her hand. We did the retail therapy, and she was actually moving and leaning more than we've ever seen her because she's so focused on trying to get the yes. And so when we got done with that, I think everyone was surprised at how much she was actually moving throughout the duration of the treatment session. And getting more range,
right?
Because she's really pushing it and reaching,
And that's what keeps us going too. Like as a company, we've seen like how much difference it makes in the patient's therapy progress. So coming back to, I know therapy progress is really important on the functional scores. Have you seen significant change or meaningful change in the functional outcomes of patients because of using the?
For sure. I think it starts with building that confidence. Like, okay, now these are the same motions that we did, and then building like improving safety. So safety awareness and the timing, with my gentleman I'm using, working with now, reaction timing. So that also goes with reaction timing with balance and, being able to catch himself or be aware of his surroundings. So definitely progress with functional mobility that way.
Got it. Thank you. Anything else you would like to add?
It's really fun. It's just really like, even when I'm using it, and just puts you in a different world.
Right.
I did have another patient that on the relaxation station, it takes you to the different parts of the world.
Right.
And that's maybe somewhere no one would ever get to go.
Yes.
And so you just kind of sit there in awe and oohs and ahs and just a relaxing time.
That's amazing. And the thing is, when they're looking around, they're actually still working on this range of motion, right?
Right. And this particular patient was very anxious. She had very high anxiety, and it was a bad day for her. And so I put that on her, and we were still able to get her to get into a calming state and still get some functional motion, but get her to the more calming, so that she could be safe for the rest of the day.
So we've actually had some clinicians tell us that they used our relaxing exercises to sometimes bring people's blood pressure down.
Yes.
If it's high, and also like to decrease that stress and anxiety so they can actually do their therapy session afterwards and get through the rest of the day.